This workshop is part of a project that we're doing with partners across Europe, funded by the European Commission. It's the second project we've done with them. We now have 35 partners across Europe. We have these workshops, we do consultancy to advise people about use of evidence. We've had 2 conferences, and we're having a final conference in March in Frankfurt. The conference is free to participate, but we don't have money for travel, I'm afraid, or accommodation. But you can go onto our website and get more information, and we hope that you can all be registered as part of the network and learn what we're doing. It's not a research project. The idea of the project is just to bring together people across Europe so that we can discuss and we can progress how we can make better use of evidence in our work. But where Mark and I come from is part of a research centre in the Institute of Education, where we're very concerned with how to bring together research evidence in systematic reviews, and that's what we're going to discuss with you in this workshop. So our objectives in this course are to understand the role of research in evidence-informed policy and practice. And the words evidence-informed policy and practice doesn't have any big special meaning. It just means policy and practice to be informed by research. The second aim is to look more detail about what is systematic reviews as a particular method to help us in evidence-informed policy and practice. And the third bullet point is going in more detail through some of the stages of doing a systematic review, and therefore understanding what a systematic review is. Because maybe you want to do such a review, but maybe you don't want to do such a review, but you might want to use such reviews, and you need to understand a little bit about them in order to use them. And the fourth bullet point, to understand how they vary, because they're not one thing, they're many different things. And then to discuss at the last session a bit about how you interpret and apply such information in practice. So, I don't know what your expectations of the workshop were before coming here today, but this is what we were thinking we were going to discuss. So do people have any questions or points about that, or they're surprised? I thought we were going to learn about policy making in South America. No? Well, maybe when we in smaller groups, people can discuss a little bit more about what they were expecting. So, these are the different headings we're going to discuss today. I'm not going to read them out because you have them in front of you. If your eyesight is good, you can see them in front of you. So, we're going to start off just by having a general introduction to evidence-informed policy and practice. What is its role? How do we access research? What is a systematic review? And then we'll have a little discussion together. So, I'm a researcher, Mark's a researcher, we work in a university. Research is what we do. We love research, we think it's important, but we do realise that there are other things in the world apart from research. And if you're a policymaker or a practitioner, or even a member of the public deciding to buy what type of shampoo will I buy in the shop, it's not only research evidence that is going to inform your decisions. You'll have particular experience, you'll have bought different shampoo before, you did like it, you bought different food before, it tasted nice, it didn't taste nice. You'll have values, opinions, there'll be resources, some things are more expensive, there might be a really good policy idea that you have, but it would be too expensive. You may have a very interesting policy idea, but it's not politically acceptable. So these are very big, powerful influences, and research is just one part of that. So that's why we use the words evidence-informed policy and practice. The evidence informs the decisions. It's not a mechanical process. You have this information, therefore you make this decision. So it's important to say that because some people assume that it's like an automatic, technical, mechanical process. It's just one part of it. But even though research evidence, information from research, is only one part, as researchers, we spend our lives creating research evidence. We think it's important. And if you're a policymaker or a practitioner, you are making decisions which affect people. And if you're making decisions that affect people, it's really an obligation, a social obligation, a moral obligation, to have some understanding to try and find out what will be the impact, what will be the effect of those decisions. Otherwise, we are just making decisions in the dark. We should at least try to consider what we're doing. We should make sure that we're trying to make things better, that we're not making them worse. And sometimes you think that, well, it's obvious what we're doing is good, it's going to make people better. But this is an example of where people were trying to do good. They were trying to do good by introducing education programs for young people, saying that if we give young people education programs about driving and road safety, that will have a good effect. It's a nice thing to do. The intention is good. But the research showed that actually these education programs were statistically associated with increased accidents. So, good motivation, nice idea, seems obvious it will be good, but actually it increased accidents. Why? Well, we have to investigate, we have to research. Why does it increase accidents? Well, maybe it encouraged younger people to start driving there, for example. There are lots of other examples of these things. There's a very famous program in North America called Scared Straight. And this is a program where they get prisoners to come from prison to go to schools and to explain to the school children about how the prisoners made a big mistake. They went into a life of crime and they ended up in prison, and it was a big mistake. And please, young people, do not follow my mistakes. Again, this is associated with increased crime. Good intention. And in London, there is a charity collecting money for this program. And they are very good people, but maybe the evidence would make them do something slightly different. Maybe the program could be effective. Maybe if you change the program slightly, it could be effective. But we have a responsibility to check whether we're making an improvement or making things worse. It's not just a waste of resources, it's the potential negative effect. So, the examples I've given you so far are more about social policy, things maybe happening in schools, decisions made by policymakers, decision made by practitioners. But this issue of evidence is also important to members of the public too. Because as society becomes more and more complex, research evidence is important to decisions we make in our daily lives. You know, I used buying shampoo as an example. Maybe that's not a very important example. But we make decisions about our careers, we make decisions in our personal lives, and research evidence may be related to that. Also, as citizens, we are involved in voting in elections or giving opinions in public about social decisions and decisions about health and society, about genetically modified food. These are all big social issues where research evidence is important. So we think that research is important to all aspects of our lives. So it's very easy to say research is important, but how do we make use of it? Well, the first thing is, what is the question? What do we want to ask about research? What do we want to know? That must be the driver, the first thing. How can research help us? Or how might research help us? What do we want to know? And then part of that question, what do we want to know? Part of that question also is, why do we want to know? Because maybe there are assumptions behind our question. There may be ideological questions, value-based questions. They may be theoretical assumptions. Because in society, but even within one group, within one ministry, there may be different perspectives, different understandings. In England, I remember we were asked by the Department for Work and Pensions to provide them with research evidence. And we were having problems helping the ministry. And we realized the problem we had was that there were two different groups in the ministry who were asking the question, but the question had a different meaning for those two parts of the ministry. So we were getting a confused question because we hadn't unpacked, we hadn't clarified who wants to know and why. We hadn't clarified the nature of the question. You can have one sentence, one question, that people interpret in different ways. The question was about early retirement, the effects of people retiring early on their jobs. So, what do we want to know from research? Why do we want to know it? What are the assumptions? And then, well, what research has been done already? Maybe we don't need to go and do any new research. Maybe we do, maybe we don't. But the first thing is to go and look what research is available already. There's no point in spending money and time collecting new research if we already have relevant, useful information. What do we know already? And how do we know it? What type of research is it? Is it survey research? Is it small-scale qualitative research? Is it an experiment? There are many different types of research. And only then, when we know what we already know, when we know what we already know, only then maybe we go and do some new research, new primary research. What more do we want to know? And how can we know it? So this may seem very obvious. We should go through this process. But in my country, we don't always go through this process. We say, oh, we need to know this, and we fund some new research, and we rush off and go to do some new research in isolation, without first looking to see what do we already know and how do we know it. And that's what this workshop is mostly about. What do we know and how do we know it? we're going to talk about systematic reviews. So, what does systematic review mean? Systematic means rigor, some methodology. And review is an appraisal, an evaluation. So a systematic review is an evaluation of the previous research, but it's an evaluation of the previous research using an explicit method, clear method. So in primary research, like when you do a survey, you have a methodology for doing your survey. And when you write the report on your survey, you explain your methodology. And why do you explain your methodology? It's so that other people can check, oh yes, this was done in a proper, rigorous way, that the research was undertaken properly. So when I was a student, that's how I was taught to do research. You explain your method, you explain your results. But when I was asked to do a review of the literature, nobody taught me any method. I remember my tutor saying, oh, go and write a literature review. And I left his office and I thought, how? How do I do this? But I was too scared to go and ask him again how to do it. So I went to the library, I picked up a few books, I wrote a report, and he was happy. But there was no method. But for primary research, we expect a method. So for literature reviews, also, we should have a method. Or many methods. So a system, just like in primary research. Now, we make a distinction between two types or two stages of a review. One is a systematic map. And a map is just like a map, a geographic map. A map of Lithuania, a map of Latvia, a map of Estonia. But you can have different types of maps. You can have maps of geography, you can have maps of transport, you can have maps of mineral deposits, different types of maps. So it's the same, you can map research in different ways. And then we have synthesis. And the synthesis is bringing the findings of the research together to answer a question. Synthesis, is the word synthesis familiar to you? Yes. Synthesis, synthetic, create something new. So a map is a representation of what has been studied. This is the definition from the Oxford English Dictionary, and such a map of research is describing research activity. What research has been done, what was the type of research, who did it, where did they do it. How you describe the research is up to you. Just you may be interested in different types of maps of different countries. You will be interested in different types of maps of research. You may not be interested in which country the research has been done. You may just be concerned about the methodology or the focus. Oxford English Dictionary definition of synthesis: building separate elements into something new. So a synthesis of research is taking the individual elements, the different findings from different studies, and pulling them together to come up with an overall new finding. It's all the findings brought together. It is not just a list of all of the different studies. A map is more like a list. It is a new finding. It's a combination of the findings together. So, you have your question, what do we know from the research? You go and find that research, you map it out in different ways. And then you take the findings and you synthesize them together to have an overall finding. What does the research tell us? So, the review is doing what we hoped. It's answering questions. What do we know from research? Now, you may have heard about systematic reviews before, and there are many different types of systematic reviews. And the reason there are many types of systematic reviews is because there are many different types of research questions. So when you do primary research, if you have a question of how many, you count. If you have a question of process, how is something working, you'll use a different primary research method. If you're trying to do research upon how can we understand this, how can we conceptualize this, then you'll use a different type of primary research. So it's the same for reviews. If you have a different question, you'll have a different method. But when I speak to people, most people have heard about systematic reviews about one particular question, which is about impact, about effectiveness. How effective is this strategy? How effective is this policy? How effective is this intervention? How effective is this method? That's a very important question, but it's a particular question and a particular type of review. And there are many types of review. As I've said already, reviews should have a method, because reviews are a type of research. And you tell people what you did, you have an accountable method. So people can question you and they can challenge you and say, your method was not very good, your method was very good. And obviously you want to use a good method. You want to use a method that avoids making mistakes, avoids any bias. That's the question asked earlier about you want to be able to believe the evidence that you take from research. And the method also allows you to maybe do the research again. You know how people undertook the research. You can do it again and see if it's still true. So it's the same for reviews. You can review the literature again and see if you came up with the same answer. That could be just checking someone's work, or maybe you are doing the review 1 year later, 2 years later, and there are new studies. So you want to update, redo the review with the new research data. Okay. Now, I've been talking at you all the time. Now, I want you to talk, if that's okay. We're going a bit over. So I want you to imagine that you're in a meeting. We call these parent-teachers meetings. So in schools in England, occasionally, maybe once a term, the parents come to the school and have a meeting with the teachers as a group. And I want you to imagine that you're in such a meeting and somebody raises the question about homework. Is homework good or bad? And someone says, I've read a literature review, and the literature review says homework is bad for children. Bad for children. Homework is bad for children and we should stop it. Okay? So, if you were in this situation, what would you want to know about the review? So what we've done in this exercise is basically the core components of reviewing literature. Because who and why? Who did the review? Why did they review? Why did they do the review? What was the questions they were trying to answer with the review? What their method of the review was, which has many components. How did they define all the major terms in the question? Yes? How did they define children? How did they define the outcomes? How did they define bad? How did they, what were their criteria for including studies? What was the method for finding those studies? What data did they take out of those studies, and how did they synthesize them together? So what you, in this exercise, in this discussion, what you've done is to tell us what are these core components, the core stages of a review. The first is form the review team. Who is doing the review? And we put in brackets involved users. That's because we want the review to be answering a relevant question. So we want the people who are going to use the review to have some involvement in forming the question. Then you formulate that question, you form the question, and you unpack it. Thank you. Is that better? So you've got a review question and you want to unpack that question, you want to clarify the question. Because a question is normally just a sentence, and that's not enough detail. You need to be clearer about what we call the conceptual framework, but it really means the ideological and theoretical assumptions behind the review. So it's nothing magic, it's just about being clearer about what does the question really mean. And as part of that process, that leads you to think, well, what type of studies would be relevant to answering my question? If my question is about homework in England, then I'm going to look for studies that are going to tell me about England. If my question is not about all children, it's about a particular age of children or a particular subgroup of children, then we're going to look for studies like that. So clarifying the question helps you to clarify the type of studies, and we call that the inclusion criteria, the criteria for including studies in the review. Once you have the criteria of the studies that would be relevant to your review, you want to go and find those studies. And finding those studies may be easy, it may be difficult, but you need to have a plan to try and find those studies. And we call that the search strategy, the strategy for finding the studies. And then we find lots of studies, and we want to make sure that they really do fit our criteria, which we call screening, checking, screening. And then we get rid of the studies that are not relevant, and we're left with the studies that are relevant, and we will probably then want to describe those studies in some way. And that's the map, describing the studies. And then, for the synthesis, we will want to check that the studies are good enough and relevant enough for our purposes. We want to check their quality and relevance. And we also want to get data out in order to know what the findings are of each study. So we collect data for two reasons, well, several reasons more. But the main reasons are to check the quality, to map the studies, and to have the findings that we can then synthesize together. We can pull them all together to give an overall answer to the question. And then we want to tell people about what we've done, so we want to communicate and engage. Okay? So that is all that a systematic review is. And everybody really knows what a systematic review is. You told us what a systematic review was in answering these questions. But if you go and look at most literature reviews, they don't do what you say we should do. That's the problem. And that's why we need to be clearer about the method in doing the review. And that's why we need to be clearer if you are reading reviews in order to inform policy decisions, policy making. You need to know, what are you using? What is this review evidence? Can I trust it? Is it relevant? Okay. Is that clear? Any questions? Simple. We can all go home. So what we're really doing from now on is going through some of these things in a bit more detail to say, what does this mean in practice? And we've already touched upon this a little bit, because I said that some of the comments were made about who's asking the question and the nature of the question being important. So this word users of research isn't a very clear word. So what do we mean by users of research? And what we mean is anybody who might use research, and that could be anybody in society. It could be people who use services, like patients or carers or students or children doing homework, school students doing homework. It could be employers, unions, pressure groups. It could be anybody, any member of the public. It could be school teachers, other professionals. It could be people training, it could be managers, policymakers, researchers. It could be anybody.
Stakeholders.
Yeah, another word would be stakeholders. So, why would you want to involve different types of stakeholders in systematic reviews? Well, it can help clarify what the question is, and it can help ensure that the question that you are asking is relevant and useful. Now, we have a program of reviews that we undertake for the English Ministry of Health, Department of Health. And a few years ago, we suggested to them that we had representatives of patient user groups to come and be members of an advisory group for our systematic reviews. And in the beginning, there was some nervousness about this. Why do we need them? This is for the ministry. Why do you need to have these? But what has happened in practice is that having those user groups, stakeholders, on the advisory group of the review has meant that the review has been better informed. It has understood how the question, what the issue means to these stakeholders, who are very relevant stakeholders. They're the people receiving the health service. And it doesn't mean that those stakeholders necessarily make the final decision, but their view can enrich the discussion of the review, of how the review is done. Another example is that we don't just do reviews, we support other people doing reviews. So we supported a group in the University of Manchester to do a systematic review about inclusion in the class, inclusion of different minority groups and people with disabilities, the question of inclusion in schools, inclusion of different types of pupils, school students in schools. And the people in Manchester are real specialists in this area, so they wanted to do a review. But we were scared that they were, in a way, too specialist, because they have developed their way of understanding over many years. So we encouraged them to include a professor from another university who disagreed with them, who had a different opinion. And the people in Manchester were not happy to start with. And we tried to persuade them, you don't have to do what the other professor says, but please have the discussion so that you have thought through the decision you make on the particular line, the particular focus of your question. Because if you make a decision without discussion, you will make a decision without being well informed. Okay? So there are two ways you can look at it. You can bring in these different perspectives because there is one perspective which is important. This review is for this stakeholder group, and it needs to be driven by that view. But you can also use it to check out that your particular perspective, your particular line, your particular focus is going to be the most useful one for you. So, how do you involve these different groups? Because the people doing the review are likely to be researchers. They're likely to be researchers who have skills in reviewing. So in a review, you need review skills, review expertise, methodological expertise, but you also need topic expertise. And within topic expertise, you need perspective expertise, because there will be different perspectives. So our view is that you could have one question, it looks like one question, but you could really do many different reviews on that one question. Because if your question has a slightly different perspective, then your methodology will be different. And we have some empirical data to support this. Our colleague went and looked at 6 systematic reviews on accidents in older people. And within these 6 reviews, several hundred research studies had been considered. But only one study had been included in all 6 reviews. Why? Because the focus of the question was slightly different, the inclusion criteria was slightly different. So different studies, different findings, different answers. So it's really important to unpack and clarify this used perspective. Then how do you get this involved? As I said, you need to have the reviewers. So how do you get the user perspectives? Well, they might be involved in helping you do the review, actually doing the review, or they may be part of an advisory group and give advice, information. But what's very crucial is to work out what is the power of these stakeholders. Is their role to give advice, or is their role to make the decision? What is the power in the process of the different stakeholder groups? So maybe these things will become a bit clearer when we talk about individual reviews. Any questions about user perspectives? Why they're important? For me, the key message is that on one subject, on one question, you shouldn't assume there is one review. okay, there are facts, but there will be a range of different facts driven by different questions. So if you're making a policy decision, you may not just need one review, you may need several reviews, which is expensive.